I'm Dr. Art Mollen. Welcome to Hope You're Feeling Good. I've practiced medicine for over 50 years and seen the face of medicine go through a complete metamorphosis. Physicians have more diagnostic options and tools, however, less time to personalize patient care. The healthcare landscape has become more difficult to navigate, so you'll need more information to advocate for yourself. I'm here to answer your questions as well as educate you with the latest breakthroughs in medicine. At the end of the day, I hope you're motivated to take better care of your health. Hello, I'm Dr. Art Mollen, and I hope you're feeling good. I'm here to answer your questions today, but first, here's what's on my mind. Fentanyl, you've probably heard it time and time again. It's a highly addictive drug. It's prescribed medically for cancer patients. Unfortunately, what's happening is there's a lot of illicit medications and drugs out there that are being laced with the fentanyl, and people don't know what they're getting. Oftentimes, they're taking cocaine or they're taking heroin. They've ordered it online, and they're getting it in the mail, and they don't realize that these are laced with fentanyl. So you have overdoses. An overdose causes respiratory distress and can even cause death. So what you need to make sure you have on hand is naloxone. Naloxone is a medication that will help to reverse the effects of a fentanyl overdose within 2 to 3 minutes. So it's something you need to have. It comes in an auto injector, it comes in a nasal spray, and it can be available through a pharmacy. And sometimes you don't even need a prescription for the naloxone. But be careful what you're ordering online because you usually don't know what you're getting. The next thing I wanted to talk about today is bulking. There's clean bulking and there's dirty bulking. So let's say you're a weightlifter or a bodybuilder and you decide that you want to, all of a sudden gain 10 to 15 pounds. Well, you can do it by clean eating or dirty eating. The dirty eating would be, let's say you're eating pizza and you're eating French fries and you're eating a bunch of calories and you're going to gain 15 or 20 pounds over a period of a month. Well, that would be the dirty eating. But the clean eating is basically eating chicken, lean meats, fish, trying to eat peanut butter, trying to increase the roughage in your diet as well. There are a lot of ways that you can do the clean eating. So what I would suggest for people who want to eat the clean way, eat egg whites, eat salmon, eat some oatmeal, have some steak kebabs, things that aren't going to necessarily put all the fat on you. So you can gain a lot of weight by dirty eating, and you may gain it even more quickly, but you're also going to gain body fat. So you have to be very careful with what you're eating. So there's clean bulking and there's dirty bulking. Final thing that's on my mind are allergies. If you have allergies, and allergy season usually starts towards the tail end of September and it goes through November. For a lot of people out there, it's the sneezing, it's the congestion, it's feeling fatigue, a generalized feeling of weakness. Maybe you're not sleeping very well. It could be allergies. A lot of times people think, well, maybe I have a cold or maybe I have COVID, but at the end of the day, it may only be allergies. So what can you do about it? Well, first of all, I don't suggest that you necessarily take an over-the-counter nasal spray, which is called neosynephrine, because that can potentially cause a reverse effect. So if your nose is really congested, you start taking neosynephrine or Afrin nasal spray on a regular basis, you're going to develop what's called rhinitis medicamentosa. Rhinitis medicamentosa is a swelling of the nasal passage. And if you take these medications, these sprays, for more than 3 days, you're probably going to develop it. So what you want to do instead is start taking an over-the-counter nasal spray called Flonase. You could take Claritin. That works. Allegra is another over-the-counter medication for allergies, and that often works. The other thing I suggest is maybe seeing an allergist. Get skin tested. They can do skin tests and find out, are you allergic to dust mites? Are you allergic to pollen? Are you allergic to the tumbleweed or bushes or things like that, or olive trees are another common allergen. So find out what you're allergic to, and then if the allergies are really severe, they can do a test on you again, which is the skin test, find out what you're allergic to, and then they can do what's called desensitization. Desensitization is they make up an allergy kit and they give you shots on a weekly basis. They usually give you 2 shots on a weekly basis, and they do that for 6 months to a year, and that causes this desensitization so you no longer have the allergy problems that you're having. In the meantime, a medication that I often prescribe for my patients is called Singulair. Singulair 10 milligrams is what they call a leukotriene inhibitor. It inhibits the inflammatory process that actually causes the allergies, as opposed to an antihistamine, which is offsetting the histamine that's being released from allergies. So that's a possibility as well. So that's what's on my mind today. And next, we're going to answer your questions. So my first question of the day is all about green tea. Should you be drinking green tea instead of a cup of coffee every day? Well, it depends upon how much caffeine you want to take in. A cup of coffee has 100 milligrams of caffeine. A cup of green tea, well, only 27 milligrams of caffeine. So from the caffeine standpoint, probably I'd recommend the green tea over the coffee. On the other side of the coin, if you really want to increase your energy level and get a little bit pumped up for the day, well, maybe a cup of coffee might be the way to go. But there's some health benefits about green tea that you ought to be aware of. And so the evidence is suggesting that it can actually enhance your immune system. You have to be careful because there can be some liver toxicity in larger doses, but it can lower your blood sugar level. So this is an interesting thing, and I've studied the literature quite closely on this, but it's suggested that green tea may actually help to lower your blood sugar, and particularly what's called your hemoglobin A1C. That measures your blood sugar over the last 3 months. But again, you have to be careful. It can increase gastric acidity if you're drinking too much of it. So be careful with that as well. But I'd have to vote for green tea over coffee as something that you want to be taking in every day. So my next question of the day is, how do I get a 6-pack ab? Well, it's not by drinking a 6-pack, I can tell you that. A lot of weightlifters and bodybuilders, they often will try to get that 6-pack ab by doing 200, 300, 400 sit-ups a day. That's not necessarily the best way. You can do toning exercises for your abdominal muscles. There's no question about that. But what I usually suggest is you have to get really lean. If you can get yourself leaner, you're going to reduce the body fat that covers your abdominal muscles. And that's the reason you're not seeing, that ripped change in your abdominal area that you're looking for. So you have to try to lose the amount of weight that's going to actually allow you to represent your abdominal muscles in the best possible light. So that's by reducing your body weight, maybe by 15, even 20 pounds for some people, in order to get rid of that body fat in the abdominal area. But doing hundreds of sit-ups every day is not necessarily the way to get that 6-pack ab. So my next question of the day is HGH. HGH is human growth hormone. So a woman wants to know, if she takes HGH, is she going to get bulky, big muscles, or is it going to simply give her more strength and endurance? Well, here's an interesting thing. HGH, again, when we talk about those types of hormones, they're steroids. HGH, the human growth hormone, is something that is often given to children of short stature. So it is an actual prescription drug that some of the endocrinologists might prescribe for a younger child. But the HGH that's often taken, sometimes illicitly, and you you may see supplements that say that they're HGH, but on the other side of the coin, they may not actually be the full HGH type of hormone. So in women have a certain amount of testosterone, but their estrogen overshadows that. So women do not have the same amount of testosterone, again, as men do. So for them, if they take the human growth hormone, it's not going to give them the bulky, large muscles, but it may give them more strength. It may give them a little more endurance. They say it can help depression. It may even help to lower cholesterol levels. So the HGH may not be that bad for a woman in terms of giving her more strength and more endurance, but it's certainly not going to build up the large, bulky muscles as a man gets, again, because the estrogen will overshadow the amount of testosterone in her body. And those are the questions for the day, but now it's time for family medicine. Well, as you know, family medicine's my favorite because I have so many relatives and I'm constantly being barraged by their questions and texts and emails on a regular basis. So my son-in-law called me this morning and said that his parents both had COVID. Well, his mother's 70 years old and she got the COVID, but she's not having any symptoms. But his father is having symptoms, and he's having some congestion and tightness in the chest and a lot of coughing and everything. Wants to know whether he should be taking the medication prescribed for the COVID-19. So my suggestion is his mother may not need the Paxlovid, which is the medication, but his father ought to be taking it. And the reason for that is the father has other comorbidities, and so he's at a higher risk for some serious complications from COVID. In addition to that, he ought to have a chest x-ray. If he's having coughing and some chest tightness and any kind of difficulty breathing, he should definitely have a chest x-ray and also have an oxygen uptake check. So you want to make sure that, you have those oxygen meters at your house and, they will help to determine what your oxygen level is. If it starts to fall anywhere into the low 90s, then of course you want to go to the emergency room. But Paxlovid is a medication. It needs to be taken in the first 5 days that someone actually contracts COVID and is positive. And what it does is it prevents the replication of the virus. So by preventing the replication of the virus, that usually nips it in the bud and prevents it from progressing. So Paxlovid would be something that should be prescribed. And here's an interesting thing. If you go to the drugstore today, you can actually get the Paxlovid prescribed by your pharmacist. You don't need a prescription. So that's something that my son-in-law didn't realize, and he's going to relate that to his father and mother. So that's something that you ought to do. If you nip it in the bud in that first 5 days that you test positive for COVID, it could help you a lot. My next question is from my brother-in-law, who is a diabetic. He's 83 years old, and of course he's overweight and would like to lose weight. His blood sugar's been out of control lately, and so his doctor prescribed for him a drug called Ozempic. Well, Ozempic has been around for quite some time. It's a very effective drug. It's an injection. You take it once a week, and it helps to control your blood sugar. So it does this in several ways. It prevents your liver from producing more blood sugar. It prevents that blood sugar from being released into your bloodstream, helps to promote insulin, and that helps to lower blood sugar. It also slows down the emptying of food from your stomach, so that makes you feel a little bit full, and that helps to get you to lose some weight as well. The problem with that medication and some of these other medications, which are very similar, is people often have some nausea. So he just started this medication and he's been nauseous for the past week. He's even been vomiting. So for him, this medication may not work. So his doctor prescribed another medication called Zofran. And Zofran is often prescribed for patients who are taking various medications, cancer patients, to prevent nausea and everything like that. So what I don't like is having an 83-year-old start on a new medication that's causing him to have nausea And then he's going to have to take another medication to prevent the nausea. What it can affect are your kidneys and your liver. So you can have a lot of other changes going on. Again, I would opt for another medication. I would suggest that the Ozempic be discontinued for him at this point, and then try to lower his blood sugar more effectively with another medication. And it may simply be an oral medication. He may not need to take the injectable. So at 83, you have to be careful of starting new medications. So last night I got a call from my sister-in-law, and my nephew is in the emergency room. He was playing sports and he fell down and broke his wrist. So she sent me pictures of his wrist, and they were determining whether or not it was that serious. Well, it looked to me like what we call a Colles fracture. A Colles fracture is a fracture of the distal radius, and so right in the wrist part, and it was somewhat displaced. And so the emergency room doc wanted to basically reset it and felt that that would be the first step. You generally don't put a cast on right away because there's too much swelling in that area. So my sister-in-law, of course, is asking when the orthopedic surgeon's going to come in, and that's not happening tonight, according to the ER doc. So the ER doc suggests that he actually reset the wrist, and it's a simple procedure. But in the meantime, they're giving the 11-year-old some morphine to control the pain, and they're going to reset that in the emergency room. So they wind up having the ER doc reset it, and it only takes about 2 minutes to really reset a wrist like that. Let's take a look at the x-ray. You can see that it's severely displaced, and we have x-rays of it after it's reset. So yes, an orthopedic surgeon should certainly be the one that actually resets it, but emergency room docs are usually quite proficient at actually resetting a fractured wrist, again, as long as it's not fractured through the skin or anything like that. So it's what we call a closed reduction. And so the emergency room doc was able to reset it. And again, in a short period of time, in 2 minutes, having pain medication obviously helps. And then it's wrapped up and put into a kind of a temporary situation with not a full-blown plaster type of cast or fiberglass cast at this point. So the results were very effective, and patient seems to be doing quite well. He will be sent home, and for my sister-in-law, she will be taking him to an orthopedic surgeon to have it followed up. But when you go to the emergency room, don't expect to see an orthopedic surgeon right away because generally, and especially on a Sunday evening, they may not be available at your beck and call. So that's how medicine is in the 21st century, and that's family medicine for today. So my final tip of the day is beet juice. I think that beets are really good for you, and beet juice has about 100 calories, but lots of fiber and lots of nutrients. You may even consider just eating a cup of beets, which is only 50 calories, but it'll enhance your immune system, and it could be beneficial to your health. I hope you're feeling good. I'm Dr. Art Mollen.